There are only two ball and socket joints in the human body, the shoulder and the hip. The hip's function is to support the weight of the body in both static and dynamic postures. It is most important in retaining balance and is considered to be the most important element in providing good posture. This is in regards to the pelvic inclination angle, which is the relationship of the angle between the plane of the pelvic inlet and the horizontal plane. The bones in this synovial joint are articulated by the head of the femur attaching to the acetabulum of the pelvis. Both surfaces of this joint are covered with a hyaline cartilage, which is very strong and keeps the joint lubricated. There are 5 ligaments that stabilize this joint. 4 of them are extracapsular, meaning outside the synovial capsule. 3 ligaments attach the femur to all 3 bones of the pelvis and are named respectively. The iliofemoral ligament is Y-shaped and is the strongest ligament in the human body. This ligament is oriented in a way so that it is twisted when someone is in a standing position. This helps to maintain trunk stability without muscular utilization. This ligament relaxes in the sitting position to allow the pelvis to tilt backwards. The ischiofemoral and pubofemoral ligaments prevent or restrict internal rotation and abduction. The 4th extracapsular ligament is the zona orbicularis, which makes a collar around the narrowest part of the femoral neck and is covered by the other ligaments which partly radiate into it. The ligamentum teres is the 5th ligament and it is intracapsular. It is not very important ligament, but it can be vitally important as a conduit of the foveal artery to the head of the femur, although this artery is not always present in all people. The most common injuries to the hip include strains, bursitis, dislocations, and fractures. The most common diseases affecting this joint are osteoarthritis and osteoporosis. This joint is dynamic, and if conditioned properly, it can stretch very far. Extreme flexibility is part of the equation that enabled martial arts extraordinaire Bill Superfoot Wallace to have a record-setting round kick that was clocked at 70 miles per hour. What I found easy to become fascinated with was hip replacement surgeries. Hip trauma does happen and various hip surgeries are available. Due to the nature of the femur's physiological construction, the thin neck that attaches the head of the femur to the shaft is most prone to fracture in the elderly due to osteoporosis. In extreme cases, arthroplasty becomes necessary. Short and long-term satisfaction varies, as well as the materials that have been used to make prosthetic hips. Sir John Charnley is credited for his design of hip replacement using varying materials, having replaced most designs by the 1970s, and is still the foundation for many modern designs. His design included a stainless steel femoral head and stem with a ceramic head, which then articulated into a polyethylene acetabular cup that was cemented into place. Metal-on-metal artificial joints are still in use but have their own issues, including a failure rate of 6.2% after 5 years. This picture shows a non-cemented acetabular cup that is coated with a bone growth-inducing material and is supplemented by a temporary screw to aid in stability. Typically, the artificial joint is smaller in size than the original, but is still required to support the same weight. Failures and dislocations can occur with these joints, with other risks and issues including thrombosis, osteolysis, chronic pain, nerve palsy, length inequality, and even death, although this is reported at far less than even 1%. Hypersensitivity to metal is estimated to affect 10 to 15% of patients. Because of the frictional erosion of metal inherent to these joints, metal sensitivity is an issue and seems to be more prevalent in women who showed elevated iron levels in their blood. The inclusion of chromium alloys and cobalt in these joints have also led to cobalt toxicity. On any hip replacement, revision surgery becomes necessary on 1 to 3% of patients. Here are a few people related to the musical industry that have reported various hip surgeries.